EHA this year, I had an opportunity to present some updated data from the Summit study. So this is the study of bezuclastinib, which is an oral, potent, and selective tyrosine kinase inhibitor with activity against a specific KIT mutation. And in this particular trial, we're using this for patients who have non-advanced systemic mastocytosis and at least a moderate to severe symptom burden. So this is an ongoing study, a phase 2 clinical study, which is made up of 3 parts. So, and the data presented this year at EHA, we looked at the part 1 data. So as part of the initial part of this study, there was a composite analysis of safety, PK, and PD data, looking at the optimal dose between 2 different formulations in part 1A and part 1B of this study. And based on this information, we were able to identify an optimal dose to move into part 2, which was 100 milligrams of oral therapy daily. So again, this particular therapeutic is given in randomized and blinded fashion to patients with non-advanced SM. And based on the data we presented at EHA, we looked at different outcomes such as safety, and then different benefits in terms of patient-reported outcomes and other outcomes measures. So based on the data we presented at EHA, we demonstrate that bezuclastinib at this identified dose of 100 milligrams by mouth daily is well tolerated. So there have been no SAEs, and a majority of the AEs have been low grade and reversible without significant interventions, which is great. When we look at various biomarkers of mast cell burden, which again is important in this disease of overactive or overabundance of mast cells, with this particular agent, we identify that nearly all patients experience at least a 50% reduction in biomarkers of mast cell burden with treatment with bezuclastinib, again at 100 milligrams daily. This includes serum tryptase, measures of KIT mutational status in terms of VAF, and then bone marrow mast cell burden. And then the final data presented at EHA within the context of this study was some patient-reported outcomes measures in terms of how patients feel and how patients do while being treated with this particular therapeutic. So if you look at the baseline demographics, the most severe symptoms that patients reported within the context of this trial were skin-associated findings and then fatigue or tiredness. Within the context of the study, we've looked at a mastocytosis symptom severity daily diary, and we've utilized various domains and symptoms to allow patients to report how they're doing while being treated with this therapeutic. And so I think the really interesting and phenomenal thing within this reported data is that if you look across all of the domains within the context of this patient-reported outcome system, patients feel better and have had significant changes in their reported symptoms, which I think is a phenomenal thing for this patient population where people really are plagued with a lot of symptoms that really do impact their quality of life and their daily living.